How to develop an online consultation platform to grow your clinical practice. Dear doctors, this presentation will give you innovative and newer ways of reaching out the patients directly. A step-by-step approach on how to develop an online consultation platform for doctors. In the last year, more than 1 crore of Indian population consulted the homeopathic doctors online. But remember, the population of India is 1.25 billion. So we need more exposure in this area. Online homeopathy connectivity worldwide is more than 100 plus countries. So you can treat the patients across the globe. We will give you clear-cut directions on how to practice online, how to become an intercontinental practitioner in homeopathy. New generation doctors realized that it is not possible to survive with the limited number of patients from our local area. That is shared by the doctors of other system of medicine and including the homeopathy doctors. Limited number of patients from the local area. It is very difficult to survive. We needed to come up with innovative and newer ways of reaching out the patient directly. So this is the concept of online consultation, treating the patient online. And one of the beautiful advertisement by the FedEx courier system. You can also practice like this, intercontinental practitioner in homeopathy. You can treat the patients across the globe. The internet connectivity is in more than 100 plus countries. Now, what is meant by an online treatment? To avail the treatment through the internet without having to visit the doctor's clinic personally. Nowadays, many of the larger number of patients during the COVID period, they are utilizing the online consultation facility. The communication between the doctor and the patient is completed through the various medias, like the emails, telephones, chat, and video conferencing. Now, what are the main features of online consultation? Because the online treatment that will break the time, space, and language barrier. Nothing is a barrier, either the language or the space or the time for the patient and also for the doctor. Patient from any corner of the world can avail online treatment facility. And there is no time constraint also. You can complete the case record at the time convenient to you and send the medicine by speed post or by courier. So relax and earn. Relax and earn. And why online? Some statistics or analysis. 72% of the internet users say they looked online for health information within the past year. More than 75% of the internet users looked online. 52% of the smartphone owners have used their phone to look up health or medical information. 46% of the people go online for diagnosis of their illness and medical condition, otherwise called as Google patients. 46%. 10 million searches are taking place every month on Google to look for the medical professionals. Remember, 10 million searches every month on Google to look for they are looking for the medical professionals and treatment. So that's the background. And how the Jeff Bezos, the founder of Amazon, realized the benefit of internet. Now their turnover is $380 billion. He read about a report on the internet growth in a magazine during one railway journey. He realized the growth of internet, that is a 230% per year. Now his earnings, that is more than $380 billion business. So that's the background. Now we need a work culture. That's proposed by Sridharan, otherwise called as the Metro Man. Punctuality, integrity, professional competence, and social responsibility. These are all the things required for the doctors also. Punctuality, integrity, professional competence. Remember, professional competence. It is very difficult to survive with the limited number of patients from your own area. Social responsibility. And you can utilize the internet for marketing your clinic, for online consultation. the YouTube, Google Map, social media, personal website, and online consultation module plus local listing in Google. Remember, in addition to the general listing in Google, there is a category called local business. Google local business. You have to list your clinic in Google local business so that people can easily find out your clinic and the service provided by your team. And remember, hundreds of websites are available for free listing for the doctors. You have to list your profile, your CV in all this type of free websites and doctors portals like the qcare.com, OLX, Kerala, Google AdWords. That's a good, an affordable thing for advertising your clinic. That will reach more number of patients. The Facebook ad, that is also an affordable and cheap comparing to the advertisement in the newspapers. The cost is comparatively less, but the Facebook ad that will reach more number of patients from your locality. I think around 2000 rupees is only required to cover a city in Facebook ad. Then Google local business, LinkedIn, then Just Dial, Practo, Intimart, Doctors Directory India.com, medindia.net, drdata.in, dralia.in, Librite, indianmedicalsites.in, indiaheartbeat.com, mydogzone, adverse.google.co.in, adverse.google.com. These are all some areas you can list your clinic freely. Hundreds of similar websites are available nowadays. So just give your CV or profile in this all website free of cost. And online homeopathy, one of the good example from India, that is Dr. Rajesh. It's a role model for this field. He is treating patients from 180 plus countries, according to him, at the life force. Please visit this website, ask Dr. Shah, and design a good website like this. That's a very good website designed by their team. And Welcome Cure by Dr. Jawahar Shah. That's another good example. They have 100 plus global panel of expert homeopathy doctors. You can also join with this type of doctors and websites or portal so that they will direct patients to you. So, Welcome Cure by Dr. Jawahar Shah. We visit their website. That's a very good website. The website name is welcomecure.com. And HomePath designed a good mobile application that available at affordable price also. You can practice anywhere by using this mobile. Everything, the case record form, the repertorization, the materia medica, clinical tips, everything is available in this homeopathy app. Then connect your doctor. Connect to my doctor. That's also a good portal for the doctors of all systems of medicine. And you can utilize the recent platforms like MyDocZone, Curofi.com, Hogwaki.com. These are all some good doctors portals. You can list your profile. And this type of portals that contain the list of doctors from different system of medicine, and they will direct the patient to you also. So a doctor's website, the homepage should contain the detailed information about the doctor, the qualification and license. That is compulsory. You have to display your qualification and the license given by the central government or the state government to practice. And the facilities offered in your clinic, your consultation time, a booking phone number, and the booking time. Sometimes the booking time may be different because of that of consultation time, and the detailed contact information about the doctor and the Google Map. These are the basic things that should be displayed in the homepage of a doctor's website, and these things are must in the homepage itself. C1 design. That means you can treat the patients across the globe by simply sitting at your home by using a laptop or a desktop or a mobile phone. See the doctor's address, the phone number, email address, and get touching with. That means the patient can contact you, and how to reach. That is also very important. From Calicut Airport, 15 kilometers. Calicut Railway Station, 31 kilometers. Calicut City, 30 minutes. Then the nearest other railway stations like the Parapanangadi railway station, 34 kilometers. Like that, you have to list in your clinic, especially in the website, especially in the homepage itself, how to reach from the nearest railway or the bus or the airport. So you can visit my website also, drmansurali.com. It's a small website that contain the basic information about the doctor, his qualification, his presented papers, testimonials, etc., etc. So one of the best case record form that I found in homeopathy case record form that you can download from the rakvikindia.com website. It's a precise website. It is very difficult to fill the classical case record that's given in in our organ of medicine or in the repertoire. It is very difficult for an online patient to fill the entire thing. But the form designed by the Rakvik, that is precise and very easy to fill also. So visit this website to find out how to design a case record form. We need a case record form, not like the allopathy people. We need a homeopathy case record form, but it is better to avoid displaying the classical case record form. It is very difficult for the patient to fill, but the essential thing or the things that's required for a prescription, for the diagnosis, and for the management of the disease that we have to collect from the patient. So visit the rakvik.com India website for a good case record form. And the Google reviews, that is also very, very important. Ask your patient to review your performance in Google, and that is usually attached with the Google map. If you are just searching my name, Dr. Mansoor Ali Calicut, you will get the Google reviews about my patients, how they reviewed my treatment, the quality of my treatment offered, etc. So, try to ask your patient, please request your patient to write a review in your Facebook page and also in the Google map. And the local listing. As I said earlier, the local listing in Google, that is compulsory, that is an essential thing. When consumers conduct a local search on their mobile device, 50% of them visit the store within a day. In the previous days, we have to ask the neighbor or a nearby shop where is the homeopathy doctor is located. Which one is who is the best doctor in your city? That you have to inquire from the nearby shop or nearby houses. But nowadays nobody is asking the neighbor or from the nearby shop. They are just simply clicking, giving a mouse click, or simply touching their mobile phone to find out the nearby doctor. So if your clinic is not listed in the Google local business, the patient will not find out your clinic by searching in the internet. So that means people are searching for the local physicians and doctors and visit them immediately. So that is a need of your presence online. Suppose this is a Google search of homeopathy doctor. Suppose a patient is searching from Calicut homeopathy doctor. See, my name is listed on the top. Even though hundreds of doctors are there in the Calicut city, my name is listed on the top with the 4.5 star marking. That's a review by my patients, and the second is Dr. Batra's clinic. So that is a benefit of listing in Google and also in the Google map. See, suppose in a Google map, a patient is giving a keyword homeopathy doctor from the Calicut. Again, my name is listed on the top in Google map. So that is the benefit of listing your profile in Google Map and Google Local Business. And remember, this is free also. 100% free service given by Google. So spread internationally. Not limit your career to the local market. Spread nationally and internationally. First year medical student, finally a doctor after 15 years. That means after the post graduation. Don't worry, and this is not an easy task to become a good doctor. Now we will discuss how to pack the medicine and send it to the neighboring states or neighboring countries or across the globe. So the materials required, we need a good prescription, preferably in a typed format that depicting the qualification of the doctor, his designation, his registration number, etc., and including the website, and a declaration form that is available in the post office. You can send the medicine either through the India Post, and they have door-to-door delivery. Comparing to the private courier service, they are not delivering to the houses. The private courier services, they are usually delivering to the offices or this type of official premises only. They are not delivering to houses. So, but door-to-door delivery is available in India Post. You can send by speed post across India. That will reach within 1 or 2 days safely. And always remember, never write the prescription of narcotic drugs. If you are sending the medicines to abroad, like the opium, naja, the lactasis, crotalis, horridus, Naxomica, etc. Never write a prescription. You can send the medicine, but never write a prescription. They will think that it's contained the narcotics. If you are writing the opium 200, sometimes the customs people they may be mistaken that opium is inside. So never give a prescription on narcotics. And the liquid medicines are not allowed inside and outside our country because that may spoil other parcels also. So if you want the medicines, send it in a 1x form. 1x tablet is available for almost all the mother teachers. So you can opt that. So it is better not to send the liquid medicines in mother tincture form or the liquid form. You can send as in the sugar of milk in the tablet or globule, whatever it may be. So these are all the main things required. A written prescription. Declaration that is available in the courier service and also in the India Post. And it is better to send the medicine through India Post. That is cheap and affordable also compared to private courier service. The only drawback of private courier service, that means they will not deliver to the houses. But they are more faster than the India Post, especially if you are sending medicine. For example, if you are sending medicines to Australia, within 4 to 5 days that will reach Australia. But if you are sending the medicines to Australia through India Post, that may require nearly 20 days. But the cost is entirely different. You need to pay only for 450 rupees for India Post. But if you are sending medicines for 3 months to Australia, you have to pay more than 4,500 rupees to the private courier services like the DHL, Blue Dart, etc. It is better to opt India Post. If not available, you can opt DHL or Blue Dart for sending medicines to outside countries. So, medicine urgent, registered post or speed post, you can write medicine urgent, registered post or speed post, whatever it may be. You have to give the name of your patient, detailed address, including the phone number. Even though if you are sending medicines to outside your state or outside your country, the phone number is compulsory. And give a good prescription and write on the top. That means this is for the personal use. You have to write the name of the patient and the date and including the age, and you have to give the complaint. It's a case of migraine. You have to give the prescription, preferably in a typed format. You have to sign it and you have to put the seal also. In certain countries, they are demanding the ingredients. That also you have to mention, especially if you are sending medicines to UAE. You have to mention the ingredients also. What is the ingredient in the Natramor 200? And so what is the ingredient in the Calcarea for 200? And nowadays it is very difficult to send medicines to US and Canada only. All other states, also all other countries, you can send medicine through India Post or DHL or this Blue Dart. But for countries like USA and Canada, you need a certificate from the drug controller of your state. In Kerala, we have only one drug controller, that is two situated in Ernakulam, and they are the allopathic drug controller. In homeopathy, we have no drug controller. So it is very difficult to get a certificate from the drug controller. So we found some difficulties and experienced some difficulties in sending medicines to US and Canada only. In all other countries, you can send it freely. Means without any hurdle. Now, some strategies why online consultation is required. Internet users in India and other countries. India has bypassed Japan to become the world's third largest internet user after China and United States. So India bypassed Japan. After US and China, India is the third one. Internet users in India, that is around 480 million. More than 480 million people, they are using the internet in India. And the share of India population is 34.8% penetration. And internet users in the world 4.57 billion. So a big opportunity for you. Even in India itself, 480 billion people are using the internet. And India, we have 1.2 billion mobile users as of 2020. 1.2 billion mobile users. Remember, by 2020, up to this month, the second largest in the world. 500 million smartphone users in India. 890 million smartphone users we are expecting by 2022. And 7.5 lakh public Wi-Fi spot. BharatNet Phase 2 aims 100% connectivity by 2020. So as on 2020, we have 1.2 billion mobile users. Remember, there is a very good opportunity in front of you, the online consultation. And 72% of the internet users say they looked for online health information within the past year. 52% smartphone owners have used their phone to look up the health or medical information. 46% of people go online for diagnosis of their illness or medical conditions. And 10 million searches are taking place every month on Google to look for the medical professionals. Now, something interesting about the Kerala. Kerala is the first complete digital state in India with the mobile penetration 115%. In India, the penetration is only 91%, but 115% in Kerala. Mobile penetration, declared internet as a fundamental right of people, and 5,000 Wi-Fi spots across the state by 5 years. So, India 1.2 billion, 890 million smartphone users. So $1 trillion business, that's the payment market. Okay, and the doctors changed or not? The truth is that the society has changed, but the doctors have failed to keep up with the times. Am I right? So we have to come up with innovative and newer ways of reaching out the patients directly. We have to come up with innovative and newer ways of reaching out the patients directly. And remember, nowadays it is not possible to survive with the limited number of patients from our local area that is shared by the doctors of many systems of medicine. I will give you one good example how the society changed. 10 years back, the public call offices are everywhere. Mobile phone came. What happened to the public call offices? Now, every third store in the market is a mobile shop. Every third store in a market is a mobile shop. So, they inculcated the sale, service, recharges, accessories, repair, maintenance, and upgradation. So, this is the way they survived. Now the sale is available, sale of phone, the service, recharge, accessories, repair, maintenance and upgradation. Everything is available in these public call offices. They turned into a mobile service stations. So this is the way they survived. And one good lesson from the Paytm. Mr. Vijay Shekhar of Paytm changed the financial structure of India through a smartphone payment system. Remember how they survived. Means they converted the weakness as opportunity. They converted the weakness of demonetization as opportunity. Within 3 months of demonetization in March 2017, their customers become 18.5 crore with 80 lakh daily transaction and 2000 crore INR deposits daily in the wallet. Their business in January 2017 alone was about 5,000 crore. Now it is a $4 billion industry. And within 2 days of announcement of demonetization, representative visited every nook and corner of the country and trained the common man and shopkeepers on digital payment system. So they utilized the opportunity on time. Now there is a 300 million registered. They have more than 300 million registered users across India. So the society changed. My question whether the doctors changed or not. Do you know the most preferred social media is Facebook? Turnover is more than $27.64 billion. But remember, they have no content of their own. They are giving a platform for us to discuss. They are placing the advertisement. They have no content of their own, but their turnover is 27.64 billion. Uber is the largest transportation company. They are working in 633 cities and operating in 72 countries. Only 8 years in the field, the largest transportation company, but their turnover is more than $37 billion. But remember, not owned a single taxi. the largest transportation company, not an owner of a single taxi, but they are simply using the medium of internet, connecting the customer and the taxi drivers, as the Facebook is doing. They are giving us a platform to discuss, placing the advertisement, earned a lot, simply using the medium of internet. Now see Alibaba.com, the largest retailer in the world, but they are not stocking anything. They are not stocking anything. They are simply connecting the manufacturer and the customer through a medium of internet, their website or their application mobile app, earning crores of rupees. Airbnb, the largest e-lodging provider, they not owned a single lodge. Airbnb is the largest lodging provider. If you are visiting any country across the globe, just visit their website. You will get a lodge, a good hotel. But remember, they are not owned a single lodge. Hyatt is the largest hotel chain network across the globe. Their turnover is only 4.69 billion dollar. The turnover of Hyatt, the largest chain network, I mean the hotel network across the globe, their turnover is only $4.69 billion. But the turnover of Airbnb, that is $93 billion, even though they have not owned a single lodge. So how these people are utilizing the medium of internet, their website or mobile application only for earning $93 billion. But the group with the largest number of hotels, they are earning only $4.69 billion. See the difference. So the society changed. So a digital platform, your clinic, that's a good opportunity for the new generation doctors. Facebook, we have only one main office, only 150 employees at the time of their inauguration, that's 2006, but turnover is more than 27.64 billion. Limited number of employees, but they are using the medium of internet. Uber not purchased a single car, only 8 years in the field, but earned more than $37 billion through the digital platform. And see another comparison, Delta Airline. Their turnover is, they have 1,100 aircraft, 4,000 service. Their turnover is only 4,000 crore dollar. See, even though they have a lot of aircraft, lot of services, turnover is only 4,000 crore dollar. And Google purchased YouTube for $1.65 billion. Now see the revenue of the Google from the YouTube, that is $4.43 billion is the revenue. They purchased it for $1 billion, but the revenue, that is $4.43 billion. So these people are using the medium of internet for earning. Another history from the Facebook, 2.1 billion, more than 2.1 billion individuals depending upon the Facebook. Only 13 years in this field. Less number of employees, but the 7th largest financial enterprises in the world. Remember, only 13 years in this field. And we have a comparison with the General Electrics. Since April 15, 1982, 124 years ago, they have more than 3 lakh employees. But their income is comparatively very less than that of Facebook. Even though the Facebook have limited employees, around 150, they have 3 lakh employees for the GE, 124 years of tradition. But their turnover is comparing to Facebook, that is very less. So these are some top largest companies by marketing capitalization. See the Amazon. They are simply using the medium of internet, not storing anything. Then comes the Facebook, then Alibaba.com. They are not storing anything, simply connecting the customer and the manufacturer, consumer service only. But their earnings are much higher than that of other companies. And similarly, at the time of beginning of the homeobook.com and similima.com, we conducted a market survey. Now our website, homeobook.com, is the largest educational portal. More than 2 lakh visitors per month. And we get revenue from the Google also regularly by placing the advertisement by Google. But everything that is controlled by one laptop and one employee. So that's the way we are using this medium of internet for earning. So there are many examples like Paytm, the Ola cabs, Oyo rooms, etc., etc. So ready to change, prepare to change over a time. Run with the time and get success. Run with the time and get success. And you have to upload your videos. Why? You have to upload your videos. Why? Just listen to this very carefully. And YouTube has now over 2 billion users every month. A distance from Facebook's 2.6 billion. Facebook is the largest platform, 2.6 billion visitors. But YouTube has 2 billion. That will definitely cross the the Facebook within a short span of time. The YouTube will definitely cross the Facebook within a short span of time. So YouTube has the Google's most popular service with even more users than Gmail. And video on social media generates 1200% more shares than text and images combined. Remember, if you are placing a video about your clinic or about your service or any type of health related activities that generate 1200 more shares. Remember, 1200 more shares than text and images combined. So if you are giving a text advertisement or an image advertisement, but if you are giving a video advertisement or a service offering by your clinic or any public related activity or the health related video, if you are sharing in the social media, if you are generating and sharing in the social media, that you will get 1200 more shares than the text and images combined. So that's the importance of uploading your videos in the YouTube. So smartphone is a new global edition. India now a mobile first market. Government start BharatNet Phase 2 aims 100% connectivity across India by 2020. And why should the physician engage in social media? We'll discuss something about that. Why the physician must engage in social media? Research has shown that an online referral carries more weight than any other form of marketing. Social media for doctors allows an interaction with the patient and position themselves as an expert in the specialty. Remember, position themselves as an expert in the specialty by the common people. And social media also affects the search rankings. Healthcare professionals trust the social media. About 60% of the people say that they trust the social media posts written by doctors. More than 60% of the people are saying like this. So they are trusting the social media. So we have to engage in social media, preferably in non-homeopathy groups that will attract more number of patients to your clinic. But give genuine and exclusively patient-friendly articles or videos. See one of our Facebook posts. Dr. Mansoor, your friends have liked your post 84,000 times. See one of our social media posts. That's a 2.6k likes and 4.4k. That means 4,400 shares for our post. So if you are concentrating on the social media, if you are utilizing social media effectively, you will get more number of patients. See, 2,600 like and 4,400 shares for my post. So utilize the internet, utilize the Google, utilize the Facebook. As I said earlier, the Facebook advertisement is comparatively very cheap, but that will reach more number of patients or more number of common people. So attitude determines your altitude. A small change in attitude makes a big difference. A small change in attitude makes big difference. But you have to take rest. Your job won't take care of you when you are sick, but your friends and family only. So stay in touch with the family and friends. So live for your family. We need good car, good house, good social reputation, but need spend some time with your family and children. Remember, spend some time. Your patient will not take care of you when you are sick, but only your friends and family. So take rest and practice only for a limited time, 3 hours, 6 hours, or whatever it may be. The rest of the time, you have to take the rest and live with the family and friends. And one recent survey by IMA, Kerala doctors die earlier than general public. They are not taking care of their health. And when businessmen become hospital owners, your job should not be like a business, but you can market ethically and effectively. You can market your clinic ethically and effectively. So visit our website, the largest portal on homeopathic education. More than 5,000 PowerPoint presentation and more than 2,000 plus articles from the first BHMS to PhD level. And the largest placement portal in homeopathy. And the largest collection of competitive exam materials and the scope of homeopathy in different countries. If you are visiting this section, the scope of homeopathy in different countries, you will get the details on how to practice with your BHMS in different countries across the globe. And what are the additional qualifications you require, how much fee to be paid and where have to be paid that fee, everything that is listed on the scope of homeopathy. So homeopaths should see opportunity in every difficulty, but not a difficulty in every opportunity. Studying medicine is like a true love. You suffer, fail, learn, fail again, fight and grow, but you never want to let go. Okay, so these are all some certificates that is allowed to be issued by the permitted by the Central Council of Homeopathy. There are a lot of certificates we can issue, and you have to work out the expenses of your clinic also. The investment for future, always give or means deposit something for the investment for the future, then only we can grow. Money to help the people in need, that is a charity. And never use credit card, always use the debit card, because we must use the money we have, not the money someone else holding. Try to use always the debit card as far as possible, and always give 15% of expenses towards the advertisement. Otherwise, your clinic will not grow fastly. So, 15% of the expenses that we have to utilize for the advertisement. So, always support the needy, something for the charity. And the attributes of a good medical professional: clinical competence, communication skills, ethical behavior. These are the three main things. Clinical competence, good communication skill, ethical behavior, duty, accountability, and taking responsibility. Respect for the patients, colleagues, and health system. Self-improvement and the passion for excellence. Remember the passion for excellence and humanistic value. So, a homeopathic clinic with the right ambience, tools and equipments, a responsive staff, and remember online presence goes a long way in offering high quality of service to the public. A homeopathic clinic with the right ambience, tools and equipments, responsive staff, and online presence goes a long way in offering a high quality of service to the public. So once a patient visits your clinic, make sure to create a lasting relationship through your service and communication. A satisfied patient is a brand ambassador for promoting your clinic. And above all, and the most important, that's a quality treatment. Remember, we discussed so many things in the last 3 sessions. So, the most important is a quality treatment. Money, fame, publicity, etc. will follow automatically once you achieve our mission of curing the patient. So, medicine is our passion, humanity is our religion. And do something to mark your life. You must have your own contribution to the society, your own contribution to the family, your own contribution to the homeopathic medical system, and your own contribution, some unique contribution to our country. So do something to mark your life. So in the last 3 sessions, we discussed about the prerequisites on how to start a clinic, the requisites for starting a clinic, know your needs, location of the clinic, how to select the best location that we already discussed in the first session, and how to conduct a survey, and about the size of the clinic, discussed about the interior design, how to design the reception and the purchase of medicine, how to hire the staff, patients' expectations, and how to collect the fee and the fee structure, and how to create a brand, punctuality, and something about the marketing, online consultation, digital marketing, accreditation, and clinical establishment act. These are all the things that we already discussed by these 3 sessions. So this treatment is not just words. A life gets written here. So be careful and be cautious. And the stethoscope and apron, it is the most expensive jewelry and clothes, for it costs you your youth. It's the most expensive jewelry. So we must have good vision, loyalty, and dedication. Only you can do something about it and take homeopathy into greater heights. And always remember the famous words of Dr. Seuss. You have brains in your head. You have feet in your shoes. You can steer yourself in any direction you choose. So, your attitude that determines your altitude. Your attitude determines your altitude. A small change in attitude makes big difference. So, your success that is important to us. Best wishes. Please subscribe to our channel for more videos like this. And that's all for the time being. Thank you. Thank you.